Welcome to A Shot in the Arm podcast. I'm Ben Plumley, and this is a podcast about equity and innovation in global health. And these days, global is local, more so than ever. And we're looking today at a very curious case of legal action that's happening in the United States. And bizarrely, this is a case where the Trump administration is following the lead of sorts of the Biden administration in a case where a group of religious organizations in Texas challenged a provision of the Affordable Care Act to prevent it from having to provide free of charge certain preventative services. So, to help us navigate this curious case, and particularly as it returns to the Supreme Court on the 21st of April, I'm delighted that we are joined by Eric Waskowicz, who is a senior policy manager at an organization called the United States of Care. Eric, welcome to A Shot in the Arm podcast.
It's great to be here. Thanks for having me.
So, first up, what is the United States of Care?
Great question. We're a organization, nonprofit organization, consumer rights organization that is focused on making sure that everyone has access to affordable, comprehensive healthcare, regardless of background, health needs, social status. We work in the states to kind of push forward pragmatic policy solutions to ensure access to care, affordable access to care. And I think what really sets us apart is really we listen to people in terms of identifying our policy priorities. And so we have a very robust research department here at US of Care that conducts focus groups, research, polling with folks across the country. We made contact with thousands of people really to kind of understand that question, what about the healthcare system frustrates them, excites them, makes them anxious, makes them nervous. And we take those concerns and those hopes and translate them into policy. Historically, we've only been active on the state level. We've really increased our presence federally as well. And so we really want to take those lessons learned on the state level as it relates to protecting access to preventive care and really translating that into federal action as well. And I think the unique thing about the case that we're going to be talking about today is it really does straddle both the state and federal world. And so excited to kind of talk more about that for you.
And United States of Care has quite a list of who's who as founders and supporters, from stars in the podcast field, John Favreau from Crooked Media, of course, but also friends of this pod, Sandra Hernandez from the California Wellness Foundation. And did it come into being really to support the drive to a more equitable approach to healthcare that the Affordable Care Act began to enshrine?
I think so. More equitable, more affordable, more accessible. We really came into being in the beginning years of the first Trump administration, where we saw folks on the left were really pushing for single payer, folks to the right were looking to repeal Obamacare for the Affordable Care Act. We really saw the need for a group that really was focused on preserving the gains of Obamacare, but also building upon that. We really were focused on a pragmatic approach to change the healthcare system. And we really were able to tap into both Democratic and Republican support to kind of identify what are those solutions that brings us together to move the ball forward to increase access to affordable coverage for everyone. And we built on that for the past 5, 6, 7 years now. And so that's really been our North Star over this time, both on the state and federal levels.
Commenting on the bipartisan nature of it, I see that Bill Frist, the former Republican senator, is also associated with the United States of Care. So, let's talk a little bit then about this court case. Originally, it was Braidwood Management versus, I'm blocking on the guy's name, the previous Secretary of State for Health.
Secretary Becerra.
Becerra, that's right. I guess I've blocked on it because everything now is about the current Secretary of Health, Bobby Kennedy Jr., who is now named in the action. So can you tell us a bit about the background to this? It's essentially about whether preventative services under the Affordable Care Act can essentially be provided free of charge, or whether there are co-pays that people need to cover themselves, and how that impacts the access and the effectiveness of those preventative services.
Yeah, so I think it's important to kind of start at what things looked like before the Affordable Care Act was passed in 2010. And so, there was no mandate in place at that point for plans to cover any sort of preventive care. And so you would have plans that would cover care, preventive care services, but maybe not at full cost, maybe not for free. You would have some plans that would carry maybe some maternal care benefits, but not others. And so the whole point of the Affordable Care Act, or one of many points, was to really kind of set a floor for coverage for plans across the country, right? If you were in Alaska versus Massachusetts versus Arkansas, you could be assured that, if you purchase coverage, private coverage, you could be assured that a certain subset of services would be covered for preventive care for free. And so that was kind of put in place in 2010. This existed for 10 years with no issue. Understanding the value of preventive care, insurers were able to adopt this. People saw, that, colonoscopy that used to cost me $30-$40 now is free. I'm going to be more likely to go receive that service and potentially catch cancer earlier on where it's more treatable so I can recover and lead a healthy life. 2020 rolls around, as you mentioned, there was a group of employers in Texas that took issue with this. And it's important, I think, to realize that this represents a very, very small subset of folks in the country. We're looking at, I forget the exact number, I believe 7 or 8 employers, if that. And they took issue with this requirement that these services be covered cost-free. And so over the past 5 years now, they've kind of pursued this case, through the district court level, then moving up to the circuit court level, moving up to the Supreme Court level, in challenging the requirement that these services be covered for free. So what does that mean for people? If this were to go through, if the Supreme Court were to rule that the mandate would be invalidated in full or in part, these services that people have come to take advantage of for free for the past 15 years now would now be subject to increased cost sharing. And we know from research that, cost sharing as little as $1 or $2 can be a real barrier for people to access those services. And with preventive care, there isn't that urgent need to get that care, right? And so people aren't going to be proactively seeking this out if there's a cost associated. And so we really do believe that there's a critical importance that these services remain free so that people continue to receive those services. Because we know from our listening work and talking to people across the country, affordability is their number one concern. And any effort to reimpose cost sharing, we see as a step in the absolute wrong direction. And that's something that's agreed to by all people. This is one of the most popular provisions of the Affordable Care Act. 80-90% of people support these cost-free protections. Why would we want to go back to a system which is patchwork across the country and really reintroduce that uncertainty to a lot of people?
So going back to 2020 and this small group of Texan employers led by this self-identified Christian employers group, Braidwood Management, they were really focused on having to provide pre-exposure prophylaxis, HIV preventative services, weren't they? And they were approaching it from both a sense of overreach in the way the Affordable Care Act decided on what services could be covered and the way in which those decisions were made, and we can come on to that. But they were also looking at making the case that there were religious exceptions to having to provide services that went against their religious values. Do you think that they understood at that point that there were ramifications much broader than HIV? Because in what sense would there be any religious objection to getting cancer screening or a whole range of other non-communicable diseases?
Yeah, it's a great question. I don't want to speak to their motivations for raising the case, but I will say HIV prevention medication, PrEP, is a modern miracle drug in terms of prevention. As a PrEP user myself, it's something that's incredibly important. It's incredibly effective. And for populations that have historically been disproportionately impacted by HIV, this is huge. And I think it's important to understand that if these protections, these no-cost protections were not in place, we're looking at hundreds and hundreds of dollars, if not thousands of dollars to pay for these medications. And that's just not feasible for a lot of folks. I'll be the first to say if there were hundreds of dollars of copays per month for me, I'd think twice about taking it. And I think that could be said for a lot of folks. And so I think it's important to understand that these are proven treatments, these are proven screenings, these are proven preventive care services that benefit a lot of people, both PrEP, but also lung cancer screenings, hypertension screenings. The reason why your annual flu vaccine is covered for free is because of this mandate. You can go down the line and really just speak to the importance of these services across the board. Like I said, I don't want to speak to the motivations of the folks that brought this case in the first place, but you're talking about a lot of services that have been deemed safe and effective by medical experts. And to retract that mandate and have the potential for increased cost sharing is an incredible step backwards. It doesn't follow the science, and it just is an incredible barrier to care for a lot of people.
In fact, it affected me very directly. I don't actually take PrEP, but at a very young age, I was diagnosed with Crohn's disease. And because of the mandate, I guess 10 years ago, I started getting colonoscopies and was able to be diagnosed with very early signs of colon cancer that were able to be treated, which otherwise would not have been identified until a good few years later. Now, I have to say, colonoscopies are not fun, the preparation more than anything else, but I'm hugely grateful that as a result of that, I now have to have colonoscopies every year. But it really is life-changing, and it so beggars the question why you would not want to do this. Now, if I understand it rightly, the Supreme Court is not going to be considering any more of these religious objections, but is going to be looking at the argument that there is overreach happening in the Department of Health and Human Services, and that and apologies for the stupid English here, that the advisory group that reports into the Secretary of Health and Human Services should in fact be appointed by the President, that it really doesn't have the authority to advise and make recommendations to the Department of Health and Human Services, and that these really need to come from the President, he or herself. Have I got it right? Is that the nub of the argument now?
More or less, and I don't want to bore your listeners with kind of the nuances of constitutional law here, but essentially that's the kind of crux of things here. And I think I'll be the first to admit I'm not a lawyer here, and so I don't want to speak too much about the kind of very kind of high level kind of constitutional questions at play here, but that is generally kind of how we are looking at things. And I think whenever we can, I think the reason why we exist and we kind of are interested in this case is kind of thinking through, okay, there's the constitutional arguments, but also then there's the arguments or the impacts on people. And I think that's what we as a advocacy organization want to let the Supreme Court know is that, hey, you can speak all you want about whether or not the appointments clause or the non-delegation clause kind of applies here, but we want to make sure that they know that, across the board, 150 million people are going to be impacted by this decision, 37 million children. And I want to go back to what you mentioned earlier about the benefit of the colorectal screening. Just the two of us here, it shows how many people benefit from these protections. This is not something that affects just 10 people in the country, right? 90% of people in this country are able to access preventive care on a regular basis. These are regular doctor's offices, doctor's appointments, visits. These are things that are very routine procedures, and anything that kind of gets in the way of that or introduces some uncertainty, even if the mandate doesn't go away, is going to potentially prevent people from accessing those services if they think, hey, this might not be covered. Even if it is, they're not going to go through that appointment. So I think it just speaks to kind of the broad-based nature of the impact of this decision and how many people could be affected by it.
Because the other aspect of this is, and we've seen this from both Republicans and Democrats, from populist and progressive parties around the world, the idea of investing in prevention rather than having to pay emergency costs for treatment and care further down the line is something that makes economic as well as social and medical sense. And I'm still trying to get my head around why there would be an argument that you don't want to invest in that, unless the argument might be that it's an individual choice and the government has no role in mandating whether or not these services become available. You yourself have to make the decision on the basis of your own choice.
Yeah, I again, don't want to speculate on the kind of cause of what the original plaintiffs kind of the reason why they brought this case, but I will say you're absolutely right on the economic argument. So setting aside what I believe is a duty to provide affordable, accessible care to folks, looking at the economic arguments. As you mentioned, providing this care on the front end, it removes folks from seeking care in the emergency room. People are able to access that care on the front end. We've seen analysis suggesting that, requiring insurers to cover these services adds maybe pennies to people's annual premiums. And so it's a very cost-effective way of getting that care across. So there's really no downside we see in requiring these services to be covered. And so it is baffling to kind of see a concerted effort to roll back these protections when we see them as a win-win-win for patients, for the healthcare system, for insurers, for providers, for doctors across the board. This is a win for everyone in the system. And it's just unfortunate we have to have this conversation in this court case when there are so many things else out there that are worth focusing and fighting for.
Right. It is an exceptionally busy time in healthcare and the courts. Another feature, I think, of the United States of Care approach was this generation, this mobilization of different health advocacy groups, patient groups, across a range of disease areas to sign on to these amicus briefs. As we were preparing for this podcast, I looked back and obviously delighted to see that the Crohn's and Colitis Foundation was there. But there really is a huge range of cancer-related organizations, lung health, right all the way to pediatric care. And how were you able to mobilize that level of support?
It's not easy, and it kind of builds off of relationships that we've built at US of Care over the past 5-6 years. We've been involved in states. We have a portfolio of about 12 or 13 states that we're actively involved in. And I think it speaks to our approach where we really focus on relationship building when we kind of go into a state and try to pass policies that promote access to affordable healthcare. Take Oregon, for example. We've been in that state for many years now. We have connections with advocacy groups, with government officials, with agency staff. And we understand that we want to be active partners to promote policies that they're supportive of, where they align with our support as well. And so I think the benefits of that arrangement is that we're able to kind of establish those relationships so that when there are issues of importance to them that they may not be aware of, like this court case, we can go to them and say, hey, we've been working with you on affordability policies for the past 5 years. Here's something that you can sign on to that will promote that on the federal level. And so I think based on that kind of year after year relationship building, which is a true testament to my colleagues, right? I work on the policy side, so I'm a little bit more cocooned than they are. They're out there kind of doing all the hard work to kind of build these relationships from the ground up. But I think it speaks to that approach, and then being able to kind of tie those relationships on the state level with relationships that we built on the national level to bring everyone together for something like this, I think really just speaks to our ability to kind of act as a bridge to bring folks together in support of a common cause. And so that was just our amicus brief. I'll also say that there were amicus briefs that were put together by other organizations, by state attorneys general, by insurers, by provider groups, the family physicians, nurses, things like that. All that are kind of just speaking with one voice here, saying to the Supreme Court, hey, we represent folks across the spectrum when it comes in the healthcare system, from nurses to insurers to patients to everyone in between. This is a terrible idea, uphold this mandate. People have come to rely on this coverage. What are you doing here? And so I think, our broad-based approach, I think, will hopefully carry through the Supreme Court and let them know that this is important to all of us.
I'm very interested in the bottom-up approach here, the mobilizing states and then connecting them with national priorities, and the extent to which you have, as an organization, consciously developed that as a policy strategy. Are there examples where you've been able to do that in red states, in Republican states, and brought them into this process?
Yeah, that's a great point. So on the amicus brief, we've had blue states, purple states, red states all come together in support of this shared priority. I think, it goes back to our focus on really trying to identify policies that have broad bipartisan support. And I think, one of those things is affordability. People are hurting in blue states and purple states and red states. And I think if we are able to identify solutions that kind of work across party lines, I think that's where our sweet spot is. And we've been able to work to codify some of these protections that Obamacare has in place, specifically related to preventive services. We've worked with states to kind of mirror those protections in state law so that if the mandate does go away on the federal level, at least there's a backstop in some states to kind of to maintain those protections. And so we've submitted testimony, delivered testimony in states to kind of promote that. In blue states, we're working in red states right now. There's a surprising amount of bipartisan consensus, despite being a part of Obamacare, to maintain these protections, again, because they've been in place for so long, people have come to enjoy them. And legislators realize, hey, if you go to get that colonoscopy that you've been getting for the past, 10, 15 years, and there's suddenly a charge, people are going to be like, maybe I'll steer clear of that. So I think people realize that. And I think that's the one thing that really, I think, sets this apart, is that there is this bipartisan consensus over maintaining no-cost access to these services.
So April the 21st, the Supreme Court reconsiders. What is happiness for you? What would be a desired outcome?
Well, if I had to wave my magic wand, I mean, the Supreme Court issues a 9-0 decision in favor of maintaining the mandate. I think that's our preferred outcome. And I think we are still convinced that the Supreme Court could uphold this, just realizing the importance of this to a lot of people. We're also under no illusions that this current Supreme Court has not been the most open to some of those arguments. And so I think that just really kind of underscores the impact and the need for our amicus brief to let them know that, like, hey, there are certainly the constitutional arguments that the lawyers in the oral arguments are going to make, but also the public health benefits, the population health benefits, the individual benefits of the mandate. And that's where we see our role.
And the very fact that the Trump administration is following on from the Biden administration and defending this, does this speak to that sense of continuity, that sense of understanding of the benefits of prevention over greater investments in treatment further down the line? Or, as others have suggested, is there another agenda that the administration might be pursuing here?
It's a great question. I think anyone that tries to predict what this administration is planning to do is a fool's errand. But I will say, I think it just speaks to the overwhelming interest in maintaining access to preventive care. I won't speak to potentially some ulterior motives on the behalf of the Trump administration, but I think, from our perspective, it shows that there is a interest in keeping people healthy. There's an interest in maintaining access to these services cost-free. There's an interest in making sure that people can have their PrEP and their colonoscopies as uncomfortable as they may be. It was, I think, a bit of a shock for us to see the new administration continue that position in some form, but it sure beats outright opposition.
Well, it is a light at the end of the tunnel that there are still some things we can all agree on, and that it puts a commonality to the cause of healthcare. Now, in the course of our conversation, Eric, you clarified that you're not a lawyer, you're a policy wonk, like me. How did you get there? What has been your career trajectory?
Oh, that's a great question. It wasn't by design. I many years ago in college, I had an internship with a senator in DC, Senator Jeanne Shaheen from New Hampshire, and internship was great. It ended, and I went back to school. Senior year rolls around, all my friends are getting positions with all sorts of companies, whatnot, and I'm just kind of twiddling my thumbs, trying to figure out what to do next. And on a whim, called the office that I work with, Senator Shaheen's office. And at the end of the call, they said, "Do you want a job?" And I said, "I wasn't planning on this, but sure." And so a year into the job, the woman, or one of the women that was doing healthcare policy, left, and the chief of staff came to me and said, "Hey, do you want to do healthcare?" And I said, "As long as you understand, I don't know the difference between a premium and a copay, I'm happy to do it." And they're like, "You'll learn." And I did. And that actually coincided with Trump's first year in office, which, if you recall, his first priority was try to repeal Obamacare the first time. And it was a terrible time to be working in healthcare policy, but also an incredibly, I'll selfishly say, incredibly informative time, because I was able to learn so much about the Affordable Care Act. And, everyone is understanding of the protections for pre-existing conditions and Medicaid expansion, but just the depth to which the Affordable Care Act really transformed American healthcare, and in many ways, but also right now, most pressingly, with the preventive services mandate, really got me hooked. And that was the seed that was planted in me. And so since then, I've kind of been doing healthcare policy jobs. I worked with the family doctors for a while, the American Academy of Family Physicians, in their state policy office, and really got my feet wet as it relates to state policy. And then with US of Care for about 3 years now, all coming on 3 years. What I love about what I do is I'm able to just really articulate the patient perspective, the person perspective. And it's just, healthcare is such a personal topic for so many people. You don't see people getting choked up about marginal tax rates, for example. There might be some people out there, I don't know. And they're probably having some tears over the past few weeks with the stock market stuff. But I'll say, really preserved Obamacare in 2017 was not the data, it wasn't the numbers, it wasn't the statistics. It was the people that had never done advocacy for at all in their life and realized that their daughter that was diagnosed with diabetes needs access to that care. Their grandmother that has breast cancer was able to be screened early because of this preventive services mandate. And it's people that don't want to make a big to-do about it, but realize how critical this was in their own lives. And I think that's just what I love about healthcare. And 9 days out of 10, it's an incredibly frustrating day to come into work because it's American healthcare. I say I have a great job security because there's so many things to fix. But on that 10th day, when you do get that breakthrough, that's the best feeling.
There's nothing like it, is there? And I do think you're right that the healthcare is not actually a specialty. Everybody at different stages in their lives needs some form of healthcare. So it's telling the story in ways that people understand and that they relate to. One further question, if you don't mind my asking, what did you study? What were your subjects?
I took the full-scale liberal arts route, and I majored in government and geography. It's minored in geography. And then just to drive my parents crazy, I almost minored in theater too. So people, they kind of stop and they're like, government and theater, that doesn't really pair together. And then they kind of pause and they're like, actually, no, that makes perfect sense.
Oh, indeed. Yes.
So it was kind of a roundabout way to get into healthcare policy, but I feel like that is not uncommon in this field where people kind of stumble across and then realize just how much of an impact they can have on people's lives and how, like I said, how personal it is to people. And they're hooked, and you blink and it's 10 years that you're in this policy field and here you are. So.
Yeah, absolutely. And just for the record, I studied theology back in the UK with no intention of ever becoming a priest, but it seemed like a good idea at the time. And it served me really well, precisely because, to your point, healthcare connects with so much, and particularly, back to our conversation about this Supreme Court judgment upcoming, the way that values and our beliefs impact what we do and the policies that affect healthcare. Well, we're coming up to the top of the hour, and I just wondered, what have we missed? Are there things that you think our viewers and listeners should be aware of as we count down to the 21st of April?
Yeah, I mean, I think I've walked through kind of the stakes at play here. You know, this is something that would roll back the clock and really act as a deterrent for people to get healthcare services they've come to rely on for free. I will say that if there's things that people can do to kind of, if they're feeling that this is something that they want to get involved in, reaching out to your state legislators for states that have not codified some of these protections in state law is certainly something that could be helpful. This is the middle of state legislative sessions. And so oftentimes most states, they run from January to June, May or June. Mm-hmm. And so for states that don't have these protections in place, it encourage folks to reach out to their legislators. And in the meantime, know that while there's a lot of uncertainty related to these services, as of right now, if you have that doctor's office appointment that's scheduled for next week, where you need that colonoscopy, know that service will be covered for free right now. The earliest that we're expecting a decision from the Supreme Court is either late June or early July. So in the interim, the mandate remains in effect for the 150 million people that that have private insurance that rely on that mandate for those services. Even after the Supreme Court comes out with the decision, just due to the nature of plan coverage, we anticipate a lot of plans to continue coverage of these services. It makes perfect sense we believe from a financial perspective and also from just a good business perspective. These services have been offered for so long, people have come to expect them. They're not going to be too happy if they go to that doctor's appointment and realize that hypertension screening is no longer covered for free. And so we believe it's an insurer's interest to cover those services. If for whatever reason that they don't cover those, in the future, oftentimes many plans in the states will have to require that notice be given to patients, 3 months ahead of any sort of benefit change. And so we do know that there are things in place to let people know that if their coverage were to change, that they be notified ahead of time. We would argue that plans shouldn't be changing this coverage. And I think a lot of plans understand that. Employers understand that. If folks aren't getting to the doctor, that might be a potentially sick employee that you may need to cover. And that's obviously not good for your bottom line if you want to set aside just the good employer arguments. And so we believe that employers and insurers will do the right thing, even if the mandate is struck down in full or in part. Again, maybe wishful thinking, but I think, there's a lot of folks that want to do the right thing here. And we want to make sure that people have that coverage.
And there's a long legacy of companies making decisions about how to invest in preventative services in the workplace. So hopefully that would appeal to them. And presumably, for our American viewers and listeners, they could go to the United States of Care website and see how they can get involved, particularly in their state level advocacy.
Absolutely. So we actually, that's either today or tomorrow, we have a existing preventive services resource hub that kind of compiles US of Care resources as well as partner resources. And tomorrow, I believe we're launching a new and updated version of that. And so, slick design, kind of updated resources. It shows a map of states that have protections in place in the event that the mandate is struck down on the federal level. And so we'd encourage folks to check that out over the next few days, weeks, months, as we're waiting for a decision. For additional information, background, talking points, how to get involved, questions they may have about their coverage, just so that people have answers over the next few months.
We will certainly include all the links in our show notes and encourage people to visit. Well, Eric, thank you very much. It's been a really informative conversation. We'll continue to monitor this closely and might come back to you, if we may, in coming months just to see how the United States continues to embrace or not embrace its commitment to preventative health. Thank you so much indeed.
Thanks for having me. This is a great conversation and hopefully good news in the future.
Yeah, fingers crossed.
All right. Thanks so much.
Well, that's it for this episode. Thank you again to Eric Waskowicz for this intriguing conversation. And I probably pronounced his name in more of a Polish way than an American way, but mea culpa. Thanks also to Eric Espera, our director and producer from News.media. And finally, a big thanks to you. Don't forget to subscribe and like us wherever you download your podcast. And of course, we're encouraging people to visit us on our YouTube channel. And again, give us 5 stars. And finally, have a great week and a safe week, everyone.